Hi, my name's David Boris. I own Hell's Kitchen Catering in Northbrook, Illinois. I don't think there's hardly any question anymore. We even hear this from the insurance companies. We hear it from every member of Congress, right, that we need to do something about the broken healthcare system in the United States of America. Yes. There is a moral imperative, yes? 87 million people last year who were without health insurance at some point during the year. 65 million people for 6 months or more woke up every morning for that 6 months hoping that would not be the day their child was diagnosed with a life-altering condition, or their spouse would find a lump or a lesion that shouldn't be there, hoping that that wouldn't be the day they got into an accident that would wipe out their life savings with an extended hospital stay. So everybody pretty much agrees that we have this moral imperative, and now how do we do it? Melissa Bean will tell you that if we just leave this in the hands of the private health insurance market, they'll get it right. Let me tell you how right they're getting it for my company. 2 weeks ago, we opened up our annual renewal. For those of you that own small businesses, you know the trepidation with which you face when you're tearing open that envelope. And we thought we might see a 10 or a 15% increase. 47% increase. If I pay this bill, I currently pay $96,000 a year to insure 12 of my employees. We'll go up to $143,000 a year. It's unaffordable for me. I'm not going to be able to pay that. So I look at my broker and I say, what the hell happened? And what do I do about it? And he says, you know, I have a company similar size to yours who actually just saw an 8% decrease. I said, how did they do that? Well, they hired younger, healthier people. So that's the answer now. So now small business is being told by the private insurance market, we don't care what business you're in. We don't care about the expertise. Hire younger, healthier people. That is a moral dilemma that small business owners should not be faced with. We should be making hiring and retention decisions based on capability, based on what innovative product can we bring to the marketplace and who are the best employees to help us bring them there. Not based on whose wife is sick or who has high cholesterol. We know that with a strong public health insurance option, a health insurance option tied to Medicare plus 5%, we know that the Congressional Budget Office says we'll save $110 billion over the next 10 years. Without that, we save only $25 billion. It's time for Melissa Bean to come out from under the skirts of the health insurance lobby and stand for the people in Northbrook. We can win this thing if we call Melissa Bean tomorrow, if we call our senators tomorrow, tell them we demand a strong public health insurance option. We are closer than we've been in 100 years to winning this thing. We're in it to win it. Make the phone calls. Get out there and talk to your representatives. Thank you.
Thank you, David. David's always a hard act to follow. I hate doing this. Yeah, you know I'm from Boston. I talk like a lobster fisherman. All right, I just want everybody to know that when we're done here, I'm not going to just pick up a phone. I'm going to the airport. I'm going to O'Hare, and I'm going to Washington, D.C. Yes. Tomorrow, I'm going to be participating in the ceremony that Speaker Pelosi, when she introduces the House legislation with a public option, a robust public option. And then, hopefully, possibly, I'm going to be meeting with President Obama. I'm going to tell him what I have to say. Yes. I'm going to tell him I'm a victim of the insurance industry because I've got high cholesterol. Hello? How many people have high cholesterol here? What an excuse.
Speak for all of us.
I'm going to bring this message loud and clear, and thank you. We need your support. And Melissa, I'm going to meet with you too, hopefully.
Good. Come on, public option. What do we want?
Public option.